Welcome back students to our channel Ach'z. So in this section we are going to discuss about today's OET test paper 13th May 2023. In so many centers they conducted OET test paper. We are going to see about the questions in detail. So in some centers in reading module part A was human scabies. So here you can see the details. Test A was classification about the shape, spread and all. Test B was about a medication, dosage, and they divided based on height and weight, and also about the exceptions in pregnancy. Test C was the classification based on the score and management. Test D with the treatment, indication, contraindication, administration of 3 different medication. And in some other centers, part A was about folks by. Test A with the definition, affected area, severities and degrees. Test B with the diagnostic finding. Test C with the treatment. And Test B with the pharmacological management. They just given in the form of a flow chart. And in some other centers, part A was about respiratory rate, test A indication, test B assessment, test C normal values. They divided based on adult, newborn and teenagers. And test D was about remarks, they given in table format. Coming towards part C, also difference in the passages in centers. In some centers, child mental health, it was a research study continued with drug trials in patients, cancer medicine, and in other centers patients encountered how to deal with the patient, especially with aggressive patients. Coming towards the listening module, in some centers part A was a conversation with a neurologist continued with a conversation with GP, and in other centers part A conversation with ophthalmologist continued with pediatrician, and other centers conversation with a nephrologist continued with physiotherapist. Now about the writing section, I will share you the question papers they got. In some centers, it was a non-case. Patient name Lean, 82 years, widow. Medical history given from 2018. Peripheral vascular disease. BP with 150/90. Medications also given. 2019, no change in status. In 2022, affected with pneumonia, and surgery was conducted under general anesthesia. Post-operation, walking compression stockings given. So we just want to refer to the district nurse already handled this patient for 2 years. So it was a reference back. So need to give recommendation regarding cooked food, geriatric care, about the stocking management, medication management and all. And in some other centers, it was again non-case, letter to GP regarding a 14-year-old with leg wound, no pus, healed wound, dressing done. 7th January, scar found out. So came for advice about the cosmetic surgery. So we just want to recommend to GP. So that's regarding both of the centers, they got the non-cases only. So now we will discuss some speaking cards also which they got for role plays. First one about childcare clinic, and it's about the discharge education. And the next card is about outpatient clinic, hernia repair, about wound dressing and all. They mentioned regarding the symptoms, the care management, and we just want to give advice regarding that. And coming towards the next one, emergency settings, snake bite, symptoms, care, advice, what all are the things they want to take care about. Okay, and the next one, child gastric trouble, parents are so worried about that, so give advice about the conditions, about the feeding technique, everything. That means what all things they want to take care about. Next one, athletic food, about the reoccurrence, and also about how to manage the condition, what all are the continuous treatment. And another card about smoking cessation in community health center, about the smoking quitting advices and also the encouragement to the patient. So these all are the cards which they got. So I think this will help you out in the coming examinations. So all the very best, and all the very best for your results to you.